Blood loss caused by major trauma such as full or partial amputation of a limb or extremity, or arterial laceration can very quickly prove fatal. The average adult resting heart rate is around 70 beats per minute. Each beat of the heart is capable of ejecting 70 milliliters of blood, which equates to almost 5 liters of blood every minute. The average adult only has 4.7 liters of blood, which means that death due to catastrophic hemorrhage can occur in under a minute. Therefore, early recognition and intervention in cases of critical bleeding is essential for survival, and must take priority over all other interventions, including establishing an airway and restoring effective breathing. Originally developed for military applications, the CAT, or Combat Application Tourniquet, is a small, lightweight device used to completely occlude arterial blood flow by applying circumferential pressure to an extremity. Once applied, the tourniquet can be locked into place to help stabilize the casualty pending further medical treatment. The device consists of a self-adhering polyester strap, friction buckle, windlass rod locking clip, and a securing tab with a facility to record the time of application. Whilst it is preferable to place the tourniquet directly onto the skin of the patient, it will still be effective over layers of clothing if access to the skin is not feasible. The tourniquet must be positioned on the upper part of the limb, upper arm or thigh. These are single bone compartments where the blood vessels can be effectively compressed against the bone. Placement of a tourniquet over a double bone compartment, lower leg or lower arm, is less effective as the twin bones in these areas may protect the blood vessels from adequate compression from the tourniquet. Release the strap and pass the loop over the injured limb and position approximately 3 fingers width above the joint. Pull the strap tightly and fasten the band back on itself. Twist the windlass rod until bright red arterial bleeding has stopped and the distal pulse has been eliminated. Place the rod into the rod locking clip and secure in place with the tab. Ongoing treatment will vary depending on how long the blood flow has been occluded. It is therefore crucial to record the time of application on the tab so that receiving medical staff can treat appropriately. Monitor the patient closely. Do not remove the tourniquet. In the unlikely event that the bleeding is not controlled, consider additional tightening, and if available, a second tourniquet can be applied beside the first. Reassure the patient. The effective application of a tourniquet is inherently painful, and it is likely that the patient will be in considerable but unavoidable discomfort. Critical hemorrhaging can lead to imminent death. The correct and timely application of this simple device is an essential life-saving intervention. For further guidance, please contact a suitably qualified trauma care instructor.